Good evening, everyone. Thank you all for joining us tonight. I'm Hannah Collins, and we're here with Dr. Kahler discussing great skincare. I'm going to go ahead and introduce him and then let him have it. Dr. Kahler is a plastic and reconstructive surgeon with West Georgia Center for Plastic Surgery in Carrollton, Georgia. He earned his medical degree from Emory University School of Medicine and completed his general surgery training at the Emory University Affiliated Hospital System in Atlanta. He completed a fellowship in plastic and reconstructive surgery at Penn State University Hospital. He also has obtained additional qualifications in endoscopic plastic surgery and laser surgery. Dr. Kahler, you can begin.
Okay, thank you very much. I'm Stephen Kahler, and welcome to our presentation on skincare, and we'll get started. So first, let's talk about the function of the skin. So the skin is the largest organ in the body. It actually weighs up to 16% of the total body weight. It's a complicated organ. It does a lot of things. It protects our body from threats externally, such as X-rays, mechanical threats like trauma, and also exposure to chemicals. It also has metabolic functions. It helps in the production of vitamin D, and it's actually essential for that because the sun converts that vitamin. And it also acts as a sense organ. So the main function of the skin is to kind of maintain our inner workings, keep them going to to their optimal amount. It prevents dehydration, and it's also a barrier to toxins and bacteria. But that means our skin is really our first line against the environment, so it really takes a beating. So that's why it's important to take good care of it. The skin also acts as a thermostat to maintain body temperature. It carries blood vessels that open up and shut down to either blow off heat or preserve heat for our core. So it's got a lot of important functions. So the goals of skincare are basically to keep the skin in good condition. It starts with cleansing. We want to get the dirt, bacteria, and dead cells off our skin. Then we want to soothe the skin to decrease itching and burning, restore our skin to its normal state by decreasing dryness and inflammation, reinforce our skin to support undamaged skin, and then protect it from external threats like the sun. The bottom line is we want to have our skin as best as it can be and have a pleasant skin feel. So let's talk a little more about the skin itself. The anatomy of the skin's here. It shows that there's an outer epidermis, which is our waterproof outer layer of skin. It helps prevent water from leaving the skin. It's continually replenished by new cells. The dermis is below it. It's that tough layer, that elastic barrier that has all the collagen in it. So it's the tough stuff. It's made out of 70% collagen by dry weight, and there's about a 4-to-1 ratio of type 1 collagen to type 3 collagen. As far as skin aging goes, it's basically can be broken down into two types. There's intrinsic skin aging, which is basically just because we're human. So we have aging that occurs outside of any external influences. So that's how old we are. There's genetic aging that occurs over time. There's what's called telomere shortening. The end of genes or the end of chromosomes tend to get shorter, and that is a sign of aging. So as much as you might think, this only accounts for about 10% of the aging process. The vast majority of our skin ages because of extrinsic forces. So this is when you're talking about the skin, not our whole body, but it's mainly the environment that makes us our skin suffer. So we're exposed to all kinds of toxins, UV exposure, pollution, stress, and free radicals that cause about 90% of our skin damage. So if you think about that, there are some things that we could help prevent some of that extrinsic damage, and we're going to talk about that. So when you think about younger versus older skin, younger skin is well hydrated, it's very elastic, and it's very firm. everybody knows how wonderful youthful skin can be. As we age, however, wrinkles show up, and these are basically associated with a decrease in collagen and elastin. And age spots show up, which is irregular pigmentation, and our skin gets more dehydrated. So that's when these wrinkles show up. UV radiation is really one of the biggest problems for our skin. So let's talk a little bit about what that is. UV radiation is part of sunlight. It's about 10% of sunlight. Sunlight's a lot more wavelengths than that. What damages our skin is the UVB, UV radiation, and the UVA radiation. So the UVA radiation is kind of a long wavelength as far as the ultraviolet part of the spectrum goes, and it tends to penetrate deeper into the skin, into the dermis, and even into the fat to cause damage. So it does damage, but not superficial damage. UVB is the real culprit that does the superficial damage. That's what gives us a skin burn or a sunburn, and it will generally hit the top layer of the skin for the most part. There is an ultraviolet C, which is also quite hazardous, but fortunately for us, it's absorbed by the upper atmosphere, so our skin never sees it. So if you think about what UVB and UV rays are doing, UVB rays are basically going into the epidermis for the most part, and they're what damage our superficial skin cells. So they cause sunburn cells if you overdo it, and these are cells that tend to get DNA damage, and then they will basically turn off and die because that's our defense mechanism against the sun. But they will be replaced by new cells, which is how we handle that. The UVA rays tend to go much deeper into the dermis, and so they do damage deeper. The key is to try to prevent this, and obviously a filter would be the best thing to do that. And these filters that we use are sunscreens. So sunscreens either absorb those rays or reflect those rays. So let's talk a little bit about sunscreens. They're our good friend. First, skin cancer. So UV damage is associated with skin cancer, and it's definitely preventable. These are the most common cancers in the United States as a whole. They certainly can be reduced and even prevented if we take care of our skin well. The bottom line is that right now, 1 in every 5 Americans has developed skin cancer in their lifetime. Now, the great majority of these are basal cell cancers, which are not super dangerous. There's millions of those that occur each year. They generally tend to be locally aggressive, but they're not likely to spread anywhere, so they're easy to take care of with treatment. Squamous cells cancer is a little more aggressive and certainly can spread through your body if you allow it, but you want to get those early. And melanoma is really the deadliest form. It basically comes from the pigment cells in the skin, and it has a high ability to spread. And certainly it's something you want to catch early and prevent if you can. So let's talk about sunscreens. Certainly we want to try to get as much sun protection as possible to help prevent skin cancer and other negative effects that the sun has on our skin. Trouble is, we love to be in the sun. So the answer to this is try to use a filter to prevent that type of sun damage. As I said, UV ray is the most preventable risk factor for skin cancer, and the ways you can protect your skin is by staying in the shade, wearing protective clothing, and there's a lot of good protective clothing out there that has good sunscreen or sun protection in it. It's become very active in sportswear. And then, of course, using sunscreen as you're supposed to. Sunscreens were actually invented in the 1930s, and they became publicly available in the 1940s. The FDA approved sunscreens, and so they actually treat them as drugs, so it's kind of hard to get them going. The SPF designation was developed in 1978. So there are basically two types of sunscreens. One of them is a physical sunscreen that they used to call a sunblock, but that's kind of out of vogue right now. They just call it a physical sunscreen, but it basically works like a shield. It sits on the surface of your skin and actually reflects the sun rays off the skin. These tend to be the metals like zinc oxide and titanium dioxide. So those are the two main physical sunscreens that we have, and they're great. I mean, I think that they've gotten a lot better over time. You don't, zinc oxide has got a lot of new forms that some of them are quite elegant, and you don't see the lifeguard with the big white thing on his nose anymore. So, and it generally is the best route to go if you have sensitive skin, because some of the chemical sunscreens can cause sensitivity to your skin. But there are many additional chemical sunscreens available in the United States, and they tend to work like a sponge, so they absorb the sun's rays rather than letting it pass through to the skin. The several ingredients available in the United States are oxybenzone, avobenzone, which tends to have good UVC coverage, and then several others. They're pretty easy to rub into the skin without leaving a residue, although I think the physical sunscreens are also now quite elegant, and they're easy to rub in now without a problem. So this kind of shows what coverage you get with certain sunscreens. As you can see, most of them have just about all of them have UVB coverage except for avobenzone, which tends to have more UVA coverage. Now, avobenzone is the only one that has complete UVA coverage except for zinc oxide. Zinc oxide covers both of them, so that's really what I would like to see is just one ingredient that can cover all of the UV damage that you might get. Generally, a lot of these skincare or a lot of these sunscreens have more than one ingredient in it to cover the UVB side and the UVA side. So just keep on the lookout for that. There are some challenges to using sunscreen. So contrary to what we may want to believe, it only is water resistance for about 1 or 2 hours. So if you've gone 2 hours and you've been sweating or exposed to the water, then you really need to reapply. So some may say they last longer than that, but I wouldn't really trust that. I think that they do have a limited amount of time that they work. They can degrade over time, and they can have some vehicle incompatibilities. Most of the time it's useful to have a sunscreen that has both oil and water soluble combinations that give the maximum UV coverage. There are also some obstacles to overcome when you're using sunscreen. Sunscreen can make the skin feel sticky. It can kind of make you weigh down the skin a little bit. It can cause acne in some people, or at least irritation like that, and facial shine. People don't like their face to shine. Some people complain about stinging after applying, but this generally has to do with the alcohol in the sunscreen. So if you get one that doesn't have alcohol, you're less likely to have any stinging. And then obviously it's not always 100% effective if you don't have full coverage of the UV spectrum by your sunscreen. Another complaint is some people say that sunscreens make you feel hotter in the sun, and there may be some truth to this, as they do convert the UV energy to heat, which heats up your skin a little bit. So that can certainly be a real thing. Overall, the health effects of sunscreen are very positive. There are a couple of questions that have been called into recently about sunscreens, and it's exactly how much of the sunscreen is absorbed. So that really wasn't appreciated until the last few years, so that's being looked at pretty actively in research. If it does get absorbed, what effects does that have? There is some evidence that it may have some pro-estrogenic effects, which may increase the risk of some cancers, but I think it's a very small risk, if any. But you may consider that when you're putting sunscreens on children that may have a question of that. I think the titanium dioxide and the zinc oxides really don't have those problems, but the chemical sunscreens seem to be the ones that are being investigated. So more to come on that. So let's talk about the components of skincare. These are actually the things that you'll use when you're using skincare products. So the first thing you need to think about is vehicles. So remember that the skin is a barrier. So something has to get through the barrier if you're going to have any kind of action on the skin. Vehicles are basically non-active ingredients that carry these active ingredients through to the skin. So the vehicle can impact the effectiveness of the product. It does create a concentration gradient, so there's a high concentration of a good active in the vehicle and none in the skin, then generally the active will move from a high concentration to a low concentration. So it certainly helps, the vehicles help do that. Some of them even act as absorption promoters. So there's glycerol or paraffin that often goes in vehicles that will help actually send things through the skin. Some also contain fragrance or preservatives, and the fragrance tends to be one of the things that's the most likely cause of irritation. So you need to watch out for that a little bit. The skin actives are actually the substances in your skincare products that work to benefit the skin. So it's an ingredient in a product that addresses the skin's concern that it's meant to be targeting. So if you're trying to build collagen, you use an active to do that. If you're trying to decrease pigment, you use an active to do that. So most of the time, these actives have had some scientific research done on them, but not everything will be understood about a lot of them, and they come along very quickly. So lots of times the technology of the actives will actually exceed the science that is trying to study them. So you do have to be a little careful about the science. Many times it's biased by manufacturers and third parties. So generally try to do your best research on it and do the best you can with that. So the ideal vehicle would be odorless, easy to apply, definitely inexpensive, cosmetically elegant, meaning it goes on without leaving much behind, non-greasy, non-irritating, and it doesn't leave a residue. And also, of course, it needs to be stable. So there are lots of skincare vehicles out there. So ointment is the most potent, but it's not something you can really walk around on your face during the day. There's also creams, emollient creams, which tend to have a great skin feel because they make the skin real soft. There are gels, lotions, which are the most diluted form of vehicle, and then sprays, tapes, and foams. Most common are the first 3 or 4 of those on the list. There's also emulsions, which you can think of kind of as a lighter version of moisturizing creams. They're typically water-based, but they can be either oil and water or water and oil. The oil and water tends to go on nice and thin, like in a lotion or a serum, and it doesn't leave any kind of excess on your skin. The water and oil tends to be a little thicker, and those are more the occlusive creams that you use at night. But the nice thing about those is they do allow better penetration of actives because they seal the skin more. So let's talk about the skincare steps. There's basically several steps. You don't have to use all these steps. Some people use more steps, but if you really want to have a simple skincare program, then use a cleanser and a moisturizer. That's the simplest thing you could do, and that's the simplest that would be recommended, and a sunscreen, of course. But typically, it's broken down into several steps. So the first step is cleansing the skin or using an exfoliator to prepare the skin. Second would be a toner to adjust the pH, and then a serum or an emulsion to carry your actives, and then a moisturizer to basically seal that in. And then usually as a final layer, a sunscreen that prevents the UV damage. So we'll take those each one at a time. As far as cleansers go, they basically are designed to remove dirt from your skin, get rid of excess oils, any bacteria that's on your skin, and take off skin cells that are exfoliating. But you don't want to disrupt the acid mantle. Now, this is something that's not very commonly talked about, but the acid mantle is the acidic film on the skin surface that has a pH of about 4.2 to 5.6, so it's pretty acidic. The reason it's like that is because it's a bacterial barrier, and it also keeps the skin surface healthy. So in general, you don't want to do something that would do something to your skin that would damage that. So that's why most of the time synthetic detergents, or what they call syndets, are preferred. These synthetic detergents have a pH of about 5 to 6, which keeps the acidic surface of the skin intact, whereas some soaps that you'd use, just bar soap or something like that, may have a pH of 9 or 10, and that can destroy the acid mantle. So the pH of your cleanser is pretty important. So when you look at when you get cleansers, look and see what the pH is, and always make sure it's slightly acidic. But the synthetic detergents tend to promote skin integrity. You do have to be on the lookout for astringents because they tend to be a little tough on your skin. Astringents usually have a good bit of alcohol in it, so you don't want to ramp that up too much. Another thing about cleansers is it seems to me that more and more cleansers are having active ingredients put into it, but I think that exactly how much good that does is really questionable, because cleansers only stay on your skin for a few minutes, so it's unlikely you're going to get much penetration of an active during this time. So it may not be worth your money to have actives in your cleansers. I would say keep it pretty simple. Another kind of first step would be exfoliators, but it's not something you're going to want to do every day because it can really strip your skin if it's a harsh exfoliator. So you want to use those one or two times a week, but not every day. It helps remove flaking skin by increasing cell turnover. They're either chemical or mechanical exfoliators. The mechanical ones have little particles in it that kind of mechanically scrub your skin, whereas the chemicals would be more something like the alpha hydroxy acids or salicylic acid, which is good for blocked pores. Next step is toners, and toners are, I think, an important step to keep your skin hydrated. They tend to calm the skin down. It can shrink the appearance of pores. It also is usually a liquid that you can seal in with your moisturizers. And one of the biggest things that toners do is restore the normal skin pH. So you want to have a toner that is in the mildly acidic range, just like your cleanser. So it'll actually add to the acid mantle and keep that barrier complete. It can also calm skin irritation. So there's lots of them have several agents in it that are calming. Basically, there are several types of toners. There's skin bracers or refreshers that are very mild. They generally have less than 10% alcohol. And a common example is rose water. Generally, a lot of these also have humectants in them, and those are agents that actually bind water from the air and then bring it to your skin. So some of them can actually add water. Skin tonics could contain up to 20% alcohol. One example of this is orange flower water. Acid toners are the hydroxy acids. So there's basically the alpha hydroxy acids, which are the fruit acids, and then the beta hydroxy acids, which is salicylic acid. They tend to be a little rougher on your skin, but they certainly can prep the skin well. And then there are astringents that people use who may have acne problems or very oily skin. They can be up to 20 to 60% alcohol, but for most people, they're just too drying for common usage. I would think that's a separate kind of special category that you use based on if you're having problems with acne or oily skin. Serums are where we get our really powerhouse actives. They're generally light and quickly absorbed by the skin. Most are water-based, so they dry quickly. They can deliver many ingredients, including a wide array of active ingredients. These active ingredients can address a lot of different problems. They can stimulate growth of new collagen. They can treat brown spots, pigment spots. They can also improve photo damage on your skin and other things. So generally you want these to penetrate, and you want to layer these under moisturizers so that they get basically sealed in and then can move across the skin. Serums are really common now, and I think they're great. They tend to be a little expensive though. Moisturizers, there's a ton of moisturizers out there. So just find one you like, one that works well for you. I think you definitely want to have something that seals in water. So that mainly is to prevent transepidermal water loss. So there are basically two main types of moisturizers. They're oil-containing moisturizers, which are petrolatum based, and then there's oil-free, which is silicone based. So moisturizers more and more are also containing a greater variety of actives within the moisturizers. So the petroleum-based moisturizers have been around for a long time. Vaseline is kind of the standard. It was developed in 1872, so it's been around forever. Cosmetic grade petrolatum is what you often, most of the time, find in moisturizer, and it's probably the best moisturizer there is. These are non-allergic, non-irritants. They don't block your pores. They prevent water loss by up to 99%, and some type of petrolatum-based moisturizer is found in about 75% of the moisturizers out there. Obviously, they have a lot of ingredients, but this is one of them that prevents the water loss. These are definitely better for dry skin, but the disadvantage is they can be a little greasy on your skin. So if you like something that is more sheer, you might want to try one of the non-oil based. The silicone-based or oil-free moisturizers have several advantages. Silicone, which is medical-grade silicone anyway, is hypoallergenic, non-comedogenic. It doesn't block your pores, it's non-toxic, and it's very resistant to decomposition, so it lasts a long time on your shelf. It tends to be superior in oily skin because it doesn't add that kind of petrolatum base to your skin. It can form a bit of a film on your skin if you don't get it off all the time, and can trap some dirt, sweat, and dead cells that you need to work hard to get off with your cleanser. But these have a very elegant feel. A lot of the products that have silicone in them go on your skin and make your skin feel nice and sheer. And I personally like the skin feel with these silicone-based moisturizers. The most common thing you'll see in the silicone is in the form of dimethicone or simethicone. And if you look at a lot of your skincare labels, you'll see this as an ingredient in a lot of them, just because it feels so great on your skin. So moisturizers are great. They basically make your skin feel soft and smooth. The emollients in a moisturizer will fill in the gaps between cells and make it soft and smooth. It'll increase your skin hydration by preventing water loss, and actually, if there are humectants which take water out of the air, then it can actually add water to your skin. And the amazing thing is, just by putting a moisturizer on, you can immediately reduce the appearance of fine lines and wrinkles by about 15 to 20%. So that's pretty amazing. It mainly has to do with hydration of your skin. As it gets a little plumper, some of the fine wrinkles will go out, and I think it's great. And of course, it does deliver actives to the skin. So generally, when I'm putting a moisturizer on, I will basically first use a toner and that kind of wets my skin a little bit, or just getting out of the shower, you leave your skin a little bit wet. And you can use either a wet on wet technique by adding a moisturizer on top of that, or what they call the soak and smear technique, which is using maybe a toner to get some liquid on your skin and then seal it in with the moisturizer. So the last step is usually sunscreen. So it's the last one, but definitely not the most important. I think it's the most important step in a daily skincare routine because because UV damage is one of the biggest damages to our skin, and obviously getting a broad spectrum of UV coverage is best. Now let's talk a little bit about actives. So we'll start with antioxidants, and what are they used to prevent? And the answer is free radicals. But what are they? So free radicals are reactive oxygen species that basically are formed in our skin every moment. They're basically molecules that are missing something and then strip it off something else. So that they are produced by internal chemical reactions in our skin, and of course external influences. UV exposure can cause them, chemicals can cause them, toxins and pollution, but even our metabolism causes them. They basically can cause damage to cell membranes, lipids, proteins, and even our DNA. So it is a real thing. It's something that contributes to aging of your skin, and something you want to prevent if you can. So antioxidants are what we use for that. So they're usually natural vitamins and compounds. We actually have natural antioxidants, a lot of them in our skin. Vitamin C, vitamin E, coenzyme Q10, those are all our own natural antioxidants. Glutathione is another one. But sometimes the external insults that we get to our skin with UV damage and other pollution or other things like that can just overwhelm our skin. So it certainly makes sense to supplement the antioxidant power of skin. And we do that with add-on products that do that. So antioxidants basically neutralize free radicals to prevent damage to cellular components. So if you think about a free radical, it's on the right side of your screen. It is some kind of molecule that has an unpaired electron. So it's going to go strip an electron off another molecule so it can have its full complement of electrons. Well, it may strip it off DNA, it may strip it off a cell membrane, the lipids on a cell membrane, and damage your skin. So it literally will start a chain reaction that damages your skin. So antioxidants have an extra electron that they can donate to this free radical so that it won't hurt anything else. And of course, that can be, and the antioxidant can generally be recycled. So in our own natural system, many of them are recycled, but many times it's too much for them to handle. So yeah, that's it. That's about that. So some of these antioxidants can brighten your skin, they can calm irritation, and even smooth fine lines, although they're much better at preventing lines than they are from treating them. They're best used during the day to prevent environmental and UV light damage. So if you're thinking about when to use your antioxidants, it's not going to do as much good at night because you're not being, basically attacked by all these external threats. And much better during the day because it can actually reduce the UV damage, and a lot of these products are used in after sun products that will prevent the damage that the sun is trying to do to the skin. It can also be found, the antioxidants can also be found in oral supplements, although I'm not a big fan of those. I would really like to get it more from foods, so they are found in different food groups. So I think if you eat well, it's going to help everything. But the antioxidants certainly can prevent increasing signs of skin aging. They can definitely prevent UV radiation damage. and they can prevent wrinkles but not necessarily treat them. They can also reduce inflammation in your skin. The important thing about antioxidants is that to be effective, they have to be stabilized and properly absorbed. They have to be present in the active form, and they have to persist long enough in the active form to exert the desired effects. And that's why I like to find them in natural foods, because you know they've got all the other cofactors that are necessary to get them into your body. Sometimes in supplements, that's not necessarily the case. Sometimes in skincare products that you put on your skin, that may also be the case, may not also be the case. So it can be hard to kind of figure that out, but do the best research you can and just try to make sure that's what you're getting in the active form. So some of the common antioxidants in the skin in skincare are vitamin C and E. Caffeine is actually a big thing in skincare products. Green tea is probably the most studied of the antioxidants. It's very high in polyphenols, which help protect your skin. Grapeseed, ferulic acid is another big one that is very popular. It's often has enhanced activity when it's mixed with vitamin C and E as well. Lycopene is basically what you find in tomatoes. Anything red generally has lycopene in it, and those are great antioxidants. Coenzyme Q is a good antioxidant. And when you think about natural sources of antioxidants, pretty much fruits and vegetables are the way to go. Red grapes have resveratrol in it, which is a powerful antioxidant. Avocados have beta carotene. Broccoli and spinach basically have lutein and zeaxanthin, which are powerful antioxidants. Walnuts are probably the best nuts there are for antioxidants. And then sweet potatoes, of course, because they're kind of red and orange, they have a lot of beta carotene in them. So there are a lot of antioxidants out there, and I would say in general they have very positive effects. I think they are a useful tool for skincare, especially to prevent sun damage and prevent free radical damage to your skin. So for the most part, it's a very positive part of skincare. The next group of actives we'll talk about are peptides. So peptides have been markedly increased in skincare products since 2000. So it can do a lot of things. These are little pieces of protein, maybe 3 or 4 amino acids, maybe up to 8 or 10 amino acids, but they can help do anything from plump the skin and lips to reduce wrinkles and fine lines. They certainly can build collagen and elastin in your skin, and they can help ease inflammation by repairing damaged skin and evening out skin tones. They have a lot of different things they can do, and for that reason it can be kind of difficult to figure out which ones to use. But most of the preparations will have maybe 2 or 3 peptides in them that do different things that they'll all have positive effects on your skin. So most of these formulations, when you buy skincare off the shelf and you read the ingredients, they're usually different peptides that'll do different things. And I think they're very good, especially in under eye products, because that skin tends to be so thin, so it penetrates easily. And anytime you can build collagen in the under eye area, it's a great thing. The trouble with peptides is they're often in serums. They're often unstable in water-based formulas, so you really need to avoid light and air getting to the product because it'll generally ruin it. So there's a whole bunch of peptides out there. There's more than 25 peptides available, and choosing the right one can be pretty challenging. It's also not known exactly how all of them work, but kind of what they can do. Again, with the peptides, sometimes the science is behind the technology, meaning it's out there before it's really been a proven therapy. The potential disadvantages of peptides are that they are pretty big molecules, so how much can get through the skin is actually a question. We do know, however, that if you're in dry, aged skin, there tends to be increased absorption of these peptides, so they may have more effects in aging skin. They also, I mean, they're pretty expensive to manufacture, or can be, so I think they tend to be quite a bit more pricey than some other of the actives. And as I said, sometimes studies are lacking on effectiveness. But how do they work? So they work in several ways, and they're basically 5 different types of peptides that do things a little differently. But the most common type are those that act as carriers, so they can carry something through the skin that will be an active on the skin to be a positive effect on it. It helps actives penetrate the skin. So one of the common examples of this is copper tripeptide, which is the most studied peptide out there. It actually came along in 1973, and it has just a whole bunch of positive effects on the skin because it transports copper through your skin, which has a lot of positive effects. Peptides can also work as messengers. So they generally, when they get through the skin, they can message other cells. They can also send signals telling the cells to produce collagen and elastin. So that's pretty powerful when you think about it. And there's I would say most of the peptides out there are either carriers or messengers. There are some that act like neurotransmitters. So you may have heard of Botox in a bottle. Well, that is a product called argireline, which tends to prevent a nerve from firing and activating a muscle. But it's just how well that penetrates that's really the problem. I wouldn't say it's nearly as effective as Botox, but if some does get through to the nerve ending, then it can act in that function. Another group of proteins that are used in skincare are basically DNA repair enzymes, and this is fairly new, but they're full enzymes. They are delivered by liposomes to your skin, so even though they're big molecules, the liposomes, which are lipid-based membranes, can deliver them through the skin, and they can certainly reverse some of the sun damage, especially actinic changes in the sun. Those tend to be really pricey, however. So that basically takes us through peptides. The next group that I want to talk about are botanicals, and there's a whole bunch of these out there, and they're very complicated molecules. Not all of them are very well understood, but these are supplements that come from plants. So most of these supplements or most of these actives have anti-inflammatory effects and help soothe the skin. So that's the most of those will be of that characteristic. The disadvantage, as I said, they're poorly understood, and there's limited scientific data to support their effectiveness because they're very complicated molecules and they're difficult to study. But these are found in plants out there, and that's where we get a lot of our medications. So there's basically 3 categories of botanicals. There's the flavonoids, the carotenoids, and the polyphenols. Now, you don't really need to know that, but green tea is the one that has a lot of polyphenols in it. So these are some of the common botanicals out there. This is just the tip of the iceberg, but I could recite hundreds of them for you if you really wanted to. But the anti-inflammatory side, echinacea is one of those anti-inflammatory effects. Thuja, which is in a South American plant, basically has those properties as well. Sarsaparilla, which I don't know if you've ever had one of those, and ginkgo biloba. As far as skin soothing, you've got jojoba, which is found in just a whole lot of products, as is aloe vera. So these make your skin feel good. They soothe your skin. Allantoin is another one of those agents, and then green tea is also that. So depending on what you want to, if you want to calm down the skin and soothe it, those are the kind of agents you can use. And then, but if you're inflamed, you can use some of those on the left. So Another thing that people often want to get rid of on their skin is excess pigmentation. So pigment spots that show up over time, they're not supposed to be there. It's generally a common sign of photoaging. It's often associated with UV damage. It's also known as facial hyperpigmentation. So we see a lot of people with that problem and spend a lot of time dealing with it. So the important thing to remember about it is that it can, for the most part, be fixed, depending on what kind of pigmentation it is, but it's generally a slow process. Most of the ways we have of getting rid of pigment is by preventing additional pigment to form, and then your body has processes where it breaks down old pigment. So slowly the pigment will break down over time. It may take 3 to 4 months to see a significant improvement. Of course, there are other procedures that we can do to make it faster, get rid of the pigment, and then maintain that with products that will prevent it from coming back. But prevention is the best method when it comes to pigment. So what can we use to help fix pigmentation? Well, we talked about cleansing agents such as the alpha hydroxy acids and the beta hydroxy acids. So the alpha hydroxys basically generally have to have a very high concentration. These are the fruit acids like malic acid and glycolic acid, lactic acid. And they generally have to be a pretty high concentration to affect pigment, more than 50%. So usually you're not going to find that over the counter. So not much help there. Salicylic acid, which is a beta hydroxy acid, is used in about 2 to 3% concentration, but it only has a modest effect on pigment. So that's probably not your best bet, but over time, these hydroxy acids can lighten the skin. Another way to fix it is active ingredients that will affect the melanin formation process. So if you can stop melanin from forming, you can decrease pigmentation in skin. And then the third way are tyrosinase or tyrosine inhibitors, which is what melanin is made out of in the first place. So melanin is the pigment in our skin, and it's basically made in melanocytes, which are the cells that are pigment cells. And it liberates the melanin and protects our skin. So it's an effective absorbent of light. So it's our innate skin protection against UV damage, in addition to our innate antioxidants. So it protects our skin, it decreases the risk of folate depletion, and it helps decrease degradation of the dermis. So very important product of our skin, but something that we don't want to get out of control. So it's produced in a very multi-stage chemical process. So technically you get oxidation of tyrosine, which is that amino acid I was talking about, and then it's polymerized and creates this product called melanin. As I said, they're produced by a specialized group of cells called melanocytes. So what can you use to combat abnormal pigment formation? So, we end up with all these pigment spots on us as we get older. How do you reduce those? Well, there are products that can literally reduce production. Vitamin C is one of them. It's a really good one. And you can get vitamin C in 10 to 15% concentrations, and it's over time very effective to reduce irregular pigmentation. Chelating agents, which tend to bind copper or other metal ions in the skin, will interfere with melanin production, and they can reduce pigment over time. Retinoids are also another special class of medication. Everybody, I think, is familiar with retinol or Retin-A, and these even out the distribution of melanocytes, so they can reduce irregular spots by evening them out and spreading the melanin over a larger area so it doesn't look like a spot. So the cleansing agents for hyperpigmentation are basically, like I said, those alpha hydroxy acids, the fruit acids, lactic acid, citric acid, etc. There are keratolytic exfoliants, ones that at least take some of the keratin off our skin. But it, as I said, has a modest effect on pigment. Mainly the alpha hydroxy acids are good for smoothing your skin out and getting rid of and opening up your pores and shrinking them too. Beta hydroxy acids do the same thing. As I said, salicylic acid, it definitely is a keratolytic that's very commonly used in acne, and that's its major use at this time. So tyrosine, which is the amino acid that ends up in melanin, has enzymes that put that together. So if you can block those enzymes, that's a great thing. Typically in the United States, we've used hydroquinone as a big agent to do that because it is a tyrosinase inhibitor. But it does have some negative effects, and we'll talk about that later. As far as naturally occurring substances, arbutin is one that's found in the bearberry plant, so it's plant derived. It's just as effective as hydroquinone at reducing pigment, and you'll find it in more and more anti-pigment or brightening skin care items. Aloesin is another one. Alpha lipoic acid is not very powerful, but certainly has an effect. I think the licorice extracts have become very popular, and I think they're also quite good. They increase the dispersal and the production of melanin, and I think they act just as well as anything we have out there. Kojic acid is derived from a Japanese plant. It definitely can reduce pigment over time, and it's safe to use in up to a 1% concentration. And azelaic acid is also another mild acid out there that can be used as a 20% preparation, and that kind of preparation is equivalent to 4% hydroquinone, which is pretty much the medical standard. As far as prescription medications for hyperpigmentation, there's basically two. Hydroquinone is the most commonly used, but there are some caveats about it. It's used in a 2 to 8% concentration, but there is some evidence that it can be actually toxic to melanocytes, so it can be toxic to the pigment cells. So they don't use a whole lot of that in Europe. It seems to be something we use more commonly in the United States. But I would say if you stay on the lower side of the concentration, you're not likely to do much harm. The other thing to know about hydroquinone, it is unstable to light and air and will turn brown, and then it doesn't really work anymore. So you have to keep it shielded from the light and air. Mequinol is another. It's a 2% preparation. It is non-toxic to melanocytes, and the most common product that has it is a product called Solange, which is combined with retin-A in a 0.01% concentration, and I haven't used it, but it's something I may be looking into. The final kind of product we want to talk about are retinoids, and they're kind of a subset unto themselves. I think that they have a lot of great properties. I think that still the standard of care to me in reducing signs of facial aging and increasing collagen production is retin-A. So that is a prescription medication that you can use in up to a 0.1% concentration. Most of the time it's 0.05%. But it's a very powerful agent. It literally penetrates the skin very well and goes into the cell very easily, and even enters the nucleus of the cell and acts on genes that turn on collagen production. So it's very well studied. I wouldn't say it's completely beautifully tolerated by everybody, but for the most part, you can manage it, and I think long term it's led to the most positive effects on skin that I've seen in any one product. Retinol is about 1/10 as potent. So retinol has to penetrate the skin, and ultimately in the cell it has to be converted to retin-A. So everything else that's a retinoid is converted to Retin A to act. So Retin A is the real end product, but only about 8% of retinol, no, I'm sorry, only about 2% of retinol and maybe 0.8% of retinaldehyde are converted to Retin A, so they're not as powerful a product. But you can have them in higher concentrations. So you'll see, 0.5% retinol, which the advantage to that is it doesn't tend to cause as much flaking on your skin or irritation to your skin as Retin A does. So many times they're much more easy to tolerate and still do a lot of good for your skin. The thing, when you look on the label of a skincare product that treats wrinkles and it says retinol palmitate and retinol acetate, those are not really effective anti-aging products. Some people may try to sell them as retinoids, but they are retinoids, but they're just not active for that purpose, not anti-aging purposes. I think the only effect they have is an antioxidant effect. So you're not going to get really improvement in wrinkles with products that have retinol palmitate in them. And if you look at the label on a lot of your skincare, you're going to see that name. So it's not nearly as valuable as something like a high potency high concentration of retinol or Retin A would be. Okay, let's move on next. The main clinical effects of retinoids, they decrease skin wrinkles, and that mainly has to do with increased collagen or other effects on the extracellular matrix. So it actually causes upregulation of a lot of different substances in our skin that act in a positive way to reduce wrinkles. It also reduces skin surface roughness, and basically that's associated with an increased skin cell turnover. So it really ramps up the skin turnover on the surface of our skin, and it makes it a lot smoother. Actually, if you use it long term, you will see skin actually become a more youthful pattern. So youthful skin generally has a pretty thin epidermis and a thick dermis. So that's, young, healthy skin. As we get older, our epidermis tends to get a little bit thicker, it gets caked on with a little more cells or even keratin. And the dermis tends to get a little thinner. So retinoids can actually reduce that or reverse that process and actually make your skin into a younger version of itself. They also decrease pigmentation, as I said, by increasing the dispersion of pigment cells. In addition to the natural occurring retinoids that we looked at already, there's also a couple of synthetic retinoids that are also quite important. One of them is a second generation retinoid called Tazorac, and it's most of these are used in treatment of acne, but they also have the positive effects on skin aging that the other retinoids have, and probably just as much as Retin A. Tazorac is the second generation, and then the third generation is Differin or Adapalene. That's also used a lot for acne, but I think it can also be used very well for skincare. And these tend to be less irritating than Retin A, but they can achieve the same beneficial effects that Retin A can. So a word, kind of a word to the wise on Retin A, it is something that generally can cause your skin to be quite flaky and irritated if you use it quickly right out of the chute. So most of the time you tend to work your way up on it. You might use it 3 times a week and then ultimately increase it to every night when you get acclimatized to it. This may take a few weeks, but it's very important to use a moisturizer when you're using Retin A. So another thing that's gotten really, really popular out there are these is collagen. They're collagen hydrolysates, so it's not a giant piece of collagen out there, which is the main structural protein of our skin, but it's collagen that's been hydrolyzed or broken down into more easily dissolvable small peptides. So you put this into a beverage or whatever. It often comes as a powdered dietary supplement, and I would say over the past 6 months to a year, it's really gotten super popular. The question is this an effective skin treatment? Well, I think that the answer is not out there yet. I mean, there are some studies out there that show that there is some increased skin elasticity and skin hydration. There is increased dermal collagen and decreased fragmentation of collagen. And there's not been any adverse effects identified as yet. But I think the science on this is still very much in its infancy. It does kind of go to, it makes sense that even we have some of these peptides, which are really small, kind of like these broken down proteins, broken down collagen, that do have effects. So it's not a far reach to say, well, these collagen lysates may have positive effects. And I think, anecdotally they have. I think that certainly a lot of work has to be done to make sure that, they're made in the right way and they have these beneficial effects on skin. So the jury's still out on this, but I expect it's something that's going to be looked at much more carefully as time goes on. I have seen some positive literature on the collagen, and I hope that continues. Some of them come from some crazy sources. I mean, some come from chicken feet, pig skin, just about anything you can think of. But as long as they're kind of ground up into smaller pieces or broken down into smaller pieces, they don't tend to be a problem from a allergy point of view. So that pretty much covers the skincare ingredients and items that I wanted to talk about. Kind of going to the next level, there are non-surgical skincare treatments that can be a bigger boost to wrinkles or pigment or things like that. So there's advanced medical skincare that you can pretty much only get through prescription or your doctor's office. Botox and Dysport are basically neuromodulators that can reduce muscle or excessive muscle function that can lead to wrinkles. So I think it's used judiciously. It can be very helpful in reducing wrinkles. There's also injectable dermal filler therapy where you can inject individual wrinkles and make them smooth out. It's most of these are high hyaluronic acid, which is a normal hydrating molecule in our skin that ultimately becomes less and less over time. So this is kind of replacement therapy for that. But they generally only last about a year. And then if you're thinking about smoothing the skin and reducing pigment, certainly laser skin resurfacing can be very effective for that. It actually rejuvenates the skin. It can wipe out pigment pretty well. Some of these resurfacing lasers, the Fraxel is very good at that. It can also smooth the skin, and it gives a big jump on it, and then you can use your products afterwards to maintain your result. So if you really need to go to the next level, then that would be non-surgical skincare. If it's even more difficult to treat, such as some of the examples you're seeing here, then we eventually go to surgical skincare treatments. And one of the less invasive is BodyTite or FaceTite. These are radio frequency devices that can tighten up the skin without taking out skin. So you can use very small incisions. It's minimally invasive surgery, small incisions to remove fat and actually melt the fat and tighten up the fibrous septa that are between the fat globules, and that tightens up the skin, and then heat the skin to a certain temperature, usually 38 to 40 degrees centigrade. That turns on collagen production and helps tighten the skin. So these are newer products that we have available to us over the past maybe 5 to 7 years, and they've been very helpful in doing minimally invasive skin tightening. And then beyond that, you have the procedures that literally will take out skin and tighten skin. So those are the more invasive surgical procedures, but that's kind of out of our scope at this time. Anyway, that pretty much takes care of our discussion tonight. I want to thank everybody that joined up on our talk and really appreciate it. And please let us know if you have any questions.
Dr. Kahler, you did have a couple of questions come through.
Okay.
The first one was, do you have a sunscreen brand or type that you feel covers the needed components and is safe?
Yeah, so I think that's a good question. I mean, I think most of the sunscreens are safe, but they are being studied. I personally like the physical sunscreens. I like the zinc oxide that you can get now. That is maybe 12%. Is mostly most of the time it's SPF 30 to 50 plus, and the ones that you can get these days are very elegant. Um, they are a little more expensive than the ones that you would take to the beach usually, but it's usually what I'll use on my face when I'm at the beach. So it's a zinc oxide preparation that has a little bit of pigment in it to then it goes on just really smooth and sheer, and I never get sunburned with it. So it's a 50 plus. I'm kind of blocking on the brand right now, but we do sell it through our office. But I think it's a 12% zinc oxide that's very effective.
Okay, and you had another one that says, what's the use of a toner?
So I think toners, they do have a lot of agents in them that can calm the skin. And I think that these can be botanicals that calm the skin, like rose water. But they also adjust the pH of the skin. So most of them will be slightly acidic that matches your acid mantle, so that when you put it on, the products you put on afterwards won't necessarily change the pH of your skin. So the correct pH of your skin helps keep it healthy. Finally, they can even attract water to the skin, and many of them, are liquid, so that I like to leave mine on a little wet and then cover it with a moisturizer, and that seals that moisture in, and you're good to go.
And is there a disadvantage of using actives every day, such as vitamin C or retinoids?
Well, I think not when you get used to them. So initially, you may find that they're irritating to your skin, and if you do, you may have to back off. Use it once a week, twice a week, then 3 times a week. But eventually, you may get acclimatized to it. Another thing is that if you're getting irritated by the product that has either vitamin C or retin A in it, then it may be one of the other additives in the product that's causing you to be irritated. Like I said, if it has fragrance in it, that's one of the more common things to irritate your skin. So always be on the lookout for that. And if you have to try another product, I would do that. But I think long term, I don't think there's really a downside to using an active every day if you can tolerate it. I think most of them are all upside.
Someone also said that they have a recent change in skin quality, such as bumps and roughness. What would you recommend for a patient?
Well, I'd have to kind of see what it is, but most of the time that could be either an allergy to the product or some other type of irritation that is not working. So I think you'll have to take a good look at your product and see if there's anything in there that might be causing that. For the most part, we want to see the opposite. We want to see smoother skin that's not, irritated. So I think you'll have to look at your ingredients very carefully and see if there's anything in that product that may be doing that. And then switch to a different product that might substitute for it.
Is there anything that someone can do for rosacea?
Rosacea is very difficult. I would say that if you do have rosacea, you try to use things that will calm that down. Now, that's not generally something that I take care of on a daily basis. It's usually something that dermatologists take care of, because I think it is a very specialized problem, although very common problem. So there are, antibiotics, topical antibiotics that they can use for that. There's other soothing and soothing agents that you can use for that to kind of calm the inflammation down, and that's what most of the treatments are associated with. But I'm not really an expert on that, and I really shouldn't say too much about it.
Okay, and somebody asked, is there a line of products that can do most of skincare restoration?
I would say so. I mean, we have our own line that will kind of address each thing, and it's not that you have to have every one of the products. But I think if you're using a good cleanser, a good moisturizer, and a sunscreen, you're already doing positive things for your skin. When you add actives to that, for me, it's I think you want to have at least one antioxidant in there to try and help prevent sun damage even after you're out of the sun. And if you can get an active that will reduce wrinkling or increase collagen production, that's great. But I think you could do that in as little as 3 products, because a lot of moisturizers will have actives in them. So it'll be a product that has some kind of moisturizer, like a silicone-based or petrolatum-based moisturizer, and then mixed with that will be actives that will penetrate the skin, that may be antioxidants and anti-wrinkle products. So you could put your, cleanse your skin, put your moisturizer on, and then sunscreen, and that's all you'd have to do. So look at the products carefully on the things that you buy. Try not to get too caught up in the hype of certain things. Do a little of your own research. I mean, you can certainly look that product up online and see what's out there on it. There will be, scientific sources as well as less scientific sources. So, kind of balance those against each other.
Okay, and the last question is, what is the cost of one of y'all's assessments?
Well, generally, for a consult for us would be it's a $50 consult just for a general consult. If you're interested in something to improve your skin, and we can talk about skincare, we can talk about non-invasive methods that could do that. We can talk about minimally invasive methods, and if it's more severe, we can talk about even invasive surgery.
All right, well, that's all the questions that we had tonight. Thank you for joining us, Dr. Kahler.
All right, thank you very much. I've enjoyed it.
And everybody, we thank you too for joining us on tonight's webinar. We also want to let y'all know to please continue to check out our classes on tanner.org, classes/events, for other informative topics that are also coming up. We hope y'all all have a wonderful evening.
Thank you.